For today's discussion of the muscular system, we are going to talk about the muscles of the upper extremities, the lower extremities, and muscle movements. For your upper extremities, the first muscle that we're going to look at is called your biceps brachii. So when you look at your upper arm, the muscle there that's on the front or the anterior of the upper arm, that's called your biceps brachii. And the function of the biceps brachii is to lift the forearm. An example of an exercise of the biceps brachii would be arm curls. So if you had weights in your hands and you were curling those weights up, that would be an example of working the biceps brachii. Now, on the other side of the arm, or the back side or posterior part of the upper arm, you have what's called your triceps brachii. So where the bicep brachii is going to bend the arm, the triceps brachii has the opposite movement. It straightens the arm. And then you have a muscle called the brachioradialis. And this is located on the lateral side of the forearm. It functions to flex the forearm, and it also helps in a movement of the forearm that's called pronation and supination. So that's when you turn your arm down, and when you face your palm down, and when you turn so that your arm so that your palm is facing up. That's pronation and supination. In this illustration, you can see those muscles of the upper extremity. On the posterior side, you can see the triceps brachii. And the reason why it's called triceps is because it consists of three different heads: a long head, a lateral head, and a medial head. And then on the anterior or front side of the body, you see your biceps brachii. So it's called biceps because there's bi meaning two. There's two heads. You have a long head and a short head. And then on the forearm, you can see your muscle there, the brachioradialis, which again is important for movements like pronation and supination of the forearm. We are now going to look at muscles of the lower body or lower extremity. We'll start by talking about one of the biggest muscles in the body, and its name helps give you that indication. And this muscle is called the gluteus maximus. It's also referred to as the buttocks. The gluteus maximus is an important muscle for stabilizing the body. It also is involved with different hip movements. Now you also have what's called the gluteus medius. And the gluteus medius is located on the outer surface of one of your hip bones, which is called the ilium. And like the gluteus maximus, your gluteus medius also helps with moving your hips. So moving from the muscles that are at the pelvic girdle, we'll move down the body to muscles located in your legs. And the first muscle group that we will look at is called your quadricep muscles. Now your quadricep muscles, these are located on the front of your thigh or the anterior portion of your leg. And it's called quadricep because there are four muscles here. You have the rectus femoris, the vastus medialis, the vastus lateralis, and the vastus intermedius. And your quadricep muscle is important for its role in extending or straightening the knee, for hip flexion, and also moving the leg forward. And you can see here in this illustration the four muscles that compose the quadricep. Again, that being the rectus femoris, the vastus lateralis, and the vastus medialis, and vastus intermedius. So again, you cannot visualize the vastus intermedius because it is located under the rectus femoris. Also located on the anterior or front side of your leg, you have a muscle called the Sartorius. And interestingly, this is the longest muscle in the body. It runs from the hip across the thigh and to the medial side, or kind of that middle part of your knee. And one of the big functions for the Sartorius is that it helps to cross your legs. Next, you have your hamstring muscles. So remember that your quadriceps muscles are located on the front of the thigh, or anterior part of the thigh, while your hamstring muscles are located on the posterior or backside of the thigh. And it consists of three muscles. You have what's called your biceps femoris, your semitendinosus, and your semimembranosus. And those are the three muscles that make up the hamstring. Your hamstrings are strong muscles, and they play an important role in flexing or bending your lower leg. Moving down the leg to the lower portion, you have your calf muscles. Your calf muscle is also called your gastrocnemius, and this of course is located on the posterior or backside portion of the lower leg. Your gastrocnemius works with another muscle that's part of the calf muscles called the soleus. The soleus runs from the knee to the heel under the gastrocnemius. The gastrocnemius is important because it helps to flex your foot. So if you think about pushing down on the gas pedal, that would be a motion of plantar flexion. And then your soleus also helps you with standing and walking. Next, you have the muscle that covers your shin bone, or your tibia, and this is called the tibialis anterior. The tibialis anterior is responsible for motions such as dorsiflexion. So dorsiflexion is going to be the opposite of plantar flexion. With this, you're lifting your toes toward your leg. And then you have a movement called inversion, which is rotating that foot inward, and that is an action of the tibialis anterior. Now, I've mentioned some of these motions already in talking about the muscles of the upper and lower extremities, but now we're going to focus in on these movements more in depth. And the movements that we are going to talk about today are flexion, extension, abduction, adduction, circumduction, rotation, supination, pronation, eversion, inversion, dorsiflexion, and plantar flexion. So flexion is defined as decreasing the angle between two bones. So essentially bringing two bones closer together. It's a bending type motion. And an example of an exercise that involves flexion is going to be the biceps curl. So if you had some weights in your hands and your arms were extended down by your side and you were to curl those weights up, that would be an example of a bicep curl. And you'll notice here that as we go through these different slides, you're going to see some hyperlinks for these exercises. So I encourage you to click on those to give you a better idea of what we mean. Now, extension is going to be like the opposite movement of flexion. So rather than decreasing the joint angle between bones, extension is going to increase that angle. So those bones are going to be moving farther apart from one another. And an example of an exercise that shows extension is called the tricep extension, or push down. So with this, essentially you are pushing weight down so that your arm is straightened, and when that arm straightens, that is going to contract your tricep muscles. The next corresponding motions that we are going to look at are abduction and adduction. So abduction describes movement away from the midline. So an example would be to move your arm or leg out to the side. So moving that arm or leg again away from your torso, away from your midline. Adduction is going to be an opposite type movement. This is movement toward the midline. So if you had your arms out to your side and you brought them in towards your body, that would be an example of adduction. If you had your leg out to the side and you brought your leg back towards your body or toward the midline, that would be another example of adduction. Now, circumduction is a combination of different movements, but essentially what it comes down to is the joint is moving in a circular type motion. And you can do the motion of circumduction at your shoulder, so you can rotate that shoulder in a circular type pattern. And circumduction is also possible at your hip. And you can see that in these pictures on the slide. Now, another type of motion is called rotation. And rotation is movement that allows a bone to move around a central axis. A common example of what rotation would look like is simply shaking your head no. You're rotating the head and neck. Another example would be like twisting at your waist. Those are going to be ways that your muscles cause the movement of rotation. Now, supination and pronation describe movements of the forearm, and you can think about how whether your palm is facing up or down. So supination, your palm is facing up. Supination can also be described as when you walk that the weight is going to be on the outside of the foot, and pronation is going to be when the palm faces down. And an example of pronation with the foot would be that the ankles were going to lean inward. Okay. So most of the weight in pronation is going to be inward versus most of the weight is going to be on the outward side of the foot with supination. Next we have the movements eversion and inversion. So eversion just simply means to turn outward. Okay. So rotating at the ankle so that your toes are turning outward. And then inversion means turning inward. So taking those toes and rotating them inward toward the body. And then lastly, we are looking at dorsiflexion and plantar flexion. With dorsiflexion, the dorsum, which is the top of the foot, is going to be elevated with the toes pointing up. So almost trying to bring your toes towards your body. That would be an example of dorsiflexion. Plantar flexion is going to be like the opposite movement. So this is when the bottom of the foot is going to be directed downward. So you think about pointing your toes, again, or pressing on the gas pedal. That is going to be an example of plantar flexion. And that concludes our discussion today of the muscles of the upper extremities, lower extremities, and muscle movements.